we're going to start with our McKenzie assessment. If the pec muscle might be the problem, it might be where the pain is, but a lot of times if we think of it as possibly being a shoulder derangement and therefore having a directional preference, I generally find, and I think the McKenzie literature says that 93% of, or maybe 92% of shoulder derangements are going to be one of three major movements, and two of the movements are repetitive shoulder extension and hand behind the back stretching, which I'll demo some of that as well too. But both of those are opening up pec major and pec minor because it's rocking back that coracoid process to basically get some repetitive stretch load off of the pec minor and try to bring that down.
Hmm.
Absolutely agree with you as well too. Like you have to basically teach patients how to stretch like their upper trap and how to stretch their levator scap. Both of those muscles make insertions and attachments onto the scapula, and we talked about earlier about that scapula being rocked out, and now all of a sudden we're over recruiting the glenohumeral joint to ask out a shoulder movement. That certainly is going to overtax the pec and the pec minor. So that is all just part of the story. We get into there and definitely do like muscle work. I really love and practice pin and stretching. If I think that like it's a little bit more of like athletic and like we've kind of made some progress, then I'll start to do things that are like a little bit more active component, like things like the post isometric relaxations on the shoulders or PIRs. So that way we're working on like firing and getting deeper into stretches at the same time and really get the neurological reset across the shoulder and the pec muscle. The shoulder joint is actually one of those very few regions. I get asked about this frequently where people are like, can you adjust my shoulder? And I say like 95% of the time, I say, no, I don't want to adjust your shoulder. And the reason why is because I find that most patients can get a lot better with the self exercise and with mobilizing pressures. And
Hmm.
we already talked about earlier 6 degrees of mobility. That's amazing and that's awesome. But with all that flexibility, you have a high degree of instability. I personally view it just being too risky to thrust through the shoulder because there's just too many things that can go wrong how flexible that joint is. Instead, if I know what direction is the key movement, then I'm going to do heavy mobilizations and really work on the muscle and work on that joint flexibility. And the name of the game is that patients get better, not to crack things to stoke my ego, right?
Right. Right.
But with that said, and we did also discuss earlier, right, neck and upper back just being tightly functionally linked with the shoulder and with like the pec and that subacromial bursa. So like a little bit of investment into some neck mobilization or adjustment and upper thoracic is going to just indirectly pay off like the shoulder and the pec muscle. So